Wellness Wednesday is brought to you by Bright White Dental.
Today we are at Bright White Dental and we're going to be talking about sleep apnea. And we're with Dr. White.
Hi.
Tell us about maybe some of the chronic conditions that people can develop from sleep apnea and maybe symptoms of sleep apnea.
Sleep apnea, obstructive sleep apnea, by definition means that somebody is actually stopping breathing while they are sleeping, which sounds terrifying,
sounds scary,
right?
yeah.
And so untreated sleep apnea can lead to heart issues and other just whole body chronic inflammation in the body, stress. It's like you're running a marathon all night long, but you've been trying to recover. And so if your body can't recover and make the repairs that it needs, you're more likely to end up with mental health, anxiety, depression, cancer, all these other things that are related. So that's why it's such a huge thing that I want to be able to help people with.
Use the term airway dentistry. Tell us what that means.
So airway dentistry is not so much related to sleep apnea. Airway dentistry has more to do with the fact that as a dentist, an airway dentist, I am going to be more aware of the airway while I'm doing my treatment planning. We actually recently had a patient come to us from, I think they drove well over an hour to come see us. They are 21 years old, and if you saw them, they look very fit, but they look very, very tired and very just not very healthy. But they said, I have been diagnosed with severe sleep apnea. I need you to help me. We did a CBCT and I showed that his airway was so small, his only option to get to the root cause of his sleep apnea is going to be double jaw surgery. And he had gone through orthodontics twice to be able to breathe. He was looking at doing nasal surgeries and everything, but it's like if you can't get the air through the throat hole, what are you doing?
Yeah.
And so my mission is to make sure that our kids are being developed, their jaws are being developed, and the orthodontics and the airways being minded during that. Because otherwise, if we're not doing that, we are going to end up with sleep apnea. We will have upper airway resistance syndrome. A lot of people are walking around with upper airway resistance syndrome. They're very tired and they don't know why. They're actually not obstructing at night, but they are being disturbed enough that they're being brought out of that REM sleep, which is where we need to go to be able to heal properly. And so that will eventually become mild, moderate, and then severe sleep apnea if it's not addressed. And like I said, a lot of the root cause to a lot of the health issues that we see as a nation is rooted in sleep, which is why our motto here is whole body health starts with your mouth.
If someone's experiencing sleep apnea, what would you say to them if they were thinking of other ways to come and seek treatment?
So if you suspect you may have sleep apnea, obviously always talk to your primary care provider. They may refer you to the sleep clinic for a sleep study, but sometimes that can take months or even years is what I was hearing. And we need to get on this now. So I make it very easy at Bright White Dental. If you come in for a sleep consult, you could leave that day with a home sleep study kit for usually less than what your copay would be with your medical doctor, and you don't have to wait. That sleep study will be read by a certified sleep physician. We will get that information back. We will go through all of that information with you and figure out the next best steps for you, whether that is a CPAP, because some people do need a CPAP. Maybe it's that surgery, like I was talking about. Maybe you want, jaw surgery. Maybe you don't want to do that. You want to do an oral appliance. I always encourage people to try their CPAP. We make oral appliances now. It's a lot easier to get coverage, medical coverage. We do bill medical for those appliances. If you've tried a CPAP, you will more likely qualify for it if you have moderate or severe sleep apnea. Myofunctional therapy, that's another great thing for people with sleep apnea, and we have that here now too. The process for making an oral appliance is very easy. We have a scanner, an intraoral scanner, so we actually don't have to take an impression anymore. We have you do some jaw movements, and we have the lab fabricated. I really love the Panthera. It's a very nice, light, does not obstruct the tongue, which of course we want to stay out of that tongue space. That tongue needs to be in your mouth.
If people are looking to come get help, where can they go to find more information?
If you want more information or if you want to do a sleep study, we are accepting new patients for that. You can give us a call.
So before coming to Bright White Dental, what challenges were you experiencing when you were sleeping?
Well, I just didn't sleep well at night, probably because I snored a lot. And so I came here and she just got me this appliance and it just works perfect. I don't snore because let me tell you, when my granddaughter spends the night, she would tell me if I were snoring. And I just sleep better with it in.
Talk about the oral appliance. What were the changes you noticed after using it?
I sleep better. I don't snore. It's great getting a good night's sleep. It just helps me to sleep better. I don't know why or how, but it does.
Talk about the fitting procedure. Some people might think that is complex. What was that like?
You just have a mold that you put in your mouth and it makes it solid, and then you get the appliance.
If there's someone else out there that is struggling with sleep apnea, or maybe is just struggling with sleep in general and think it is sleep apnea, what would you say to them?
I'd say come up here because she is a great dentist and she's so knowledgeable. She does such good work.